Hi, everyone. Welcome to another inspiring conversation. Today, we're joined by three remarkable women making a real difference in healthcare, science education, and community wellness. Sister Allison Andrew from Mediskills Academy, Kerusha Pillay from Helpful Scientist, and Janice Benecke from PinkDrive share how collaboration, awareness, and early detection are helping transform lives and strengthen communities across South Africa. How are you?
All good, thank you. All ready for our wonderful day that we're going to be having here today.
Yes, and I'm looking forward to you showing me around.
Okay, I'm going to do that now. I'm just going to switch the screen so that you can see where I am.
Okay, no problem.
Camera, now you can see nicely. So this is what you come in when you come into Hillcrest AIDS. You see this beautiful giraffe over here, which is so nice, bright and colorful. So it's very nice. It's actually really nice over here. And I'm so happy that we are here. And we are now going, so people come here. They've got lots of things going on here today. And
Mhm.
this is here to just show you the Hillcrest AIDS sign.
Awesome.
Okay, and then we're going to go back inside. Sorry, this is the car park, but I thought it would be nice to show you the
Of course.
giraffe, because it's so beautiful.
Yeah, it's
Okay,
amazing.
and now we are going in. There's beautiful gardens along the way here. It's very well attended.
Yes.
This is their comrades hall. Okay, let's go down. And I'm hoping that Candace is here. Okay, so this here is Candace from Hillcrest AIDS.
I can just.
I'm Candace Millman, CEO of the Hillcrest AIDS Centre Trust, and welcome to our site, which we affectionately call as Hacked. I get to join Janice as we tour around, and we'll show you a bit of what we do here.
Beautiful.
Okay.
Thank you.
Alrighty. So, well, just a little bit of background. Let me jump in there. So, Hacked is 35 years old. We were started by a local church around when HIV was first exploding within our communities within South Africa. And 35 years later, a lot of our work falls under three main pillars: education, empowerment, and health. And it's really around addressing vulnerabilities that can undermine health holistically, physically, emotionally, family, even financially. So we really come around families with wraparound service to empower them to do life well. So this is our center. This is our campus. This is our bookstore where reduce, reuse, recycle is quite a theme of ours. So we repurpose a lot of things, and it's part of an income generation, but it's also just a way of building community and resourcing community. This is our Ubuntu Ground coffee shop. The tagline is so much more than coffee. So not only do we serve amazing coffee and light meals, we do catering. We have a tuk-tuk, a mobile tuk-tuk, but it's a training space. So out of school unemployed youth can gain skills that can pivot them into workspace or entrepreneurship. This is our plant nursery.
Mhm.
The guys are busy loading for the East Coast Radio Home and Garden Show, which starts soon. They'll be there for the next 10 days, but we do our own plants, propagation, pots, and decor. We do landscaping. And again, it's a way of building community. We do a lot with community gardens and growing seedlings, but it's also a bit of an income stream for the Hack Center as well.
Awesome.
And this is, I can tell you that the scones there at that shop are delicious.
In terms of
Making me,
Bozamoya started about 23 years ago.
making me
We
tempted.
work with, it's an amazing art, economic
Okay.
empowerment based on isiZulu art and crafts. We have an art gallery upstairs. Our art gallery feature right now is our Go-Go's who are practicing for the upcoming Go-Go Olympics, which will be in
Wow.
Women's Month in August, our 11th one. But through Ozamoya, we work with about 450 crafting families that do local
Wow.
work, and we help them give economic access. So these are some of our Friday crafters. Hello, ladies. Sani Bonan.
Hello, everyone.
Some of our amazing crafters that have come together to sell or get ideas, get beads, etc. This is our white elephant. So anything that can't go into a program will come here. Our haberdashery this way is anything sewing related. Again, community can come and purchase very cost effectively. If you're in a crafty space, this is anything and everything which you can possibly imagine.
Mhm.
And this is, as I said, anything that can't go into a program will be available here as a charity shop.
Wow.
Now we're going down to our section now.
So we'll continue walking through our plant nursery. This is where a lot of our plants are propagated. If you look to the right, this is our digital literacy learning labs, those containers. So we have computer space for learners to learn about computers and digital literacy. And that's part of our education programs that we offer. These are all seedlings being grown for community gardens, granny home gardens, school gardens.
Wow. Amazing.
This is where we make pots and make our own compost. Again, this is for sale to the public. We're open 5 days a week.
And here we are here at our medical center. So here is our beautiful banner,
Mhm.
proudly sponsored by Mandy's Wax.
Okay.
Okay, and this is Kerusha.
Hi everyone, welcome. Thank you for joining us at the PinkDrive Hillcrest AIDS Centre. It's a lovely, lovely session we're having. Please come and join us and have a health check and come chat to us about gut health. We're having a lovely day out here.
That's why I said to you, your gut was not good. When you said it's your gut, that's what
Right, and here is our gazebo.
Okay.
This is where
Beautiful.
we do our breast examinations.
Okay.
So I think there's people in there, but I would love to show you inside it when there's no one there. This
Oh,
is proudly sponsored by Pakamisa, and it's
mhm.
got windows and doors. So it's got windows on the side over here that you can open when it gets too hot. This here is some of the team from Mediskills. They are doing diabetic screening here. And this is Sister Allison.
Hi, everybody.
Hello.
We're here. Hi, how are you?
Good, thanks.
He said,
We are here at the Hillcrest AIDS Centre, and we're part of Mediskills. We're here with PinkDrive, and we're just very, very happy to be here today. Thank you, Janice.
okay. All right. And here's some of the other nurses that are doing your blood pressure. And there's a lady having her blood pressure done now. And Hillcrest AIDS are also doing AIDS screening. So this is our little wellness bit. But I would like you to see, here's a shop over here where they've got secondhand shop. And this is secondhand clothes, sorry. And this is to help everybody get an income. You can
Wow.
carry
So
on.
this is Temba's closet, Hope's closet, and yeah, as Janice said, it's another community initiative, but also builds a little bit of income stream for our hospice and palliative care unit. We have a big sale every once a month, but otherwise Tuesdays and Thursdays the shop is open. So this is our wellness day. We'd love to have community members join us. Our staff and volunteers will be participating. A lot of our go-go's and our crafters will be coming through today for a range of services. It's wonderful to be able to partner with PinkDrive on this initiative. We really thank the Singh Foundation for their sponsorship of this event. And as our last bit of tour, while we're on site on CAC's campus, is our Otandweni Hospice and Palliative Care Unit. So while all of our community-based programs are in the Valley of 1,000 Hills, and we're working with primary schools, high schools, grandmothers, crafters, gender-based violence courses, leadership development, youth development. This is a major heartbeat of ours. This is a 24-bed inpatient unit for adults and children with late-stage cancer, AIDS, and other life-limiting illnesses.
So we have to be careful what we show here, okay? So I've got to just be
Okay.
careful with the camera
Sure,
because
no
you
problem.
can't show the patients. But is there anybody that side?
You can just do
So I'll do a quick little thing here.
if you can just pan through just quick.
I can just quickly pan through just to show you.
So
I have to be very careful.
24 bed
Sure,
inpatient
sure.
unit
So
for adults and children, as I said, with late stage cancer, HIV, and other life limiting illnesses. About 40% of our patients are admitted with cancer, which why this partnership with PinkDrive is fantastic. And we're already brainstorming on other ways and other connections and other dates that we can get involved. I think you're coming to our Go-Go Olympics in August. We'll
yes,
have about 800 grandmothers out on the field, but also just a way of promoting breast health and women's health overall. So we are very grateful to have PinkDrive, the Sing Foundation, all partnering with the Hillcrest AIDS Centre Trust today, sponsoring a health day, a wellness day, specifically focused around women, but holistic health. And we encourage everyone either to pop by or, continue to support our organizations. Thank you so much.
thank you so much for
Awesome.
letting us, especially come into this section, because this section is like sort of like off limits. But I'm going to take you back in case you want to see anything else or ask any other questions. I'm quite happy. Did you enjoy the tour though, Bart? Isn't it
Yeah, it's
beautiful?
very, yeah, thanks for letting me have the honor of seeing what as you go through, because it's really, what's that word? It's really an eye opener. That's the word I'm looking for.
Yeah, because now you can see where your money goes, okay? You can see that we are here, that we are
Mm.
doing all sorts of medical services and stuff. There's also one-on-one. We've also got a sister on duty here as well. And I mean, I just think it's just so lovely. And we are also
Oh,
grateful to the Sing Foundation for sponsoring us to be here.
yeah. I'm okay if you want to still show me some stuff which you feel would be important for me to see. I don't mind.
Okay, let's just have a look. I'm going to turn the camera around again. Let me just ask this lady first. Would you like to say something about how happy you are that we are here today for social media? Okay. Here's one of our patients getting her blood pressure and that done.
So relieved to have you guys here to take our blood pressure. You need it always. Got to check.
Also, you're diabetic and you must also have your boobs checked, eh?
That's true.
Okay,
You
that's
need to get
very
a big
important.
one. Yes.
Yeah.
You need a mama.
Yeah. And you know that 95% of the time your partner will find the lump in your boobs, so tell them to do their job
Oh,
properly.
wow. You got a job properly, man.
Oh gosh.
We have fun when we are here, let me tell you. Wouldn't you like to
Yeah, I can see
introduce
that.
yourself because you are here with us?
Hi, everyone. I'm Noglunga from the Hillcrest AIDS Centre. I'm the marketing and IT officer. We are doing a wellness day in conjunction with PinkDrive. So come and get your test for free. We are waiting for you.
Awesome.
There you go. Thank you very much. So I really wanted you to see inside there, but there's two ladies inside the tent. But
Mm.
what a beautiful gazebo that they sponsored us. It's not just, just like a normal tent. Is there someone on the other side? Is it? Is she nearly finished? This is our nurse. She's
Okay.
actually a registered nurse. So introduce yourself.
My name is Sister Yola, and I represent Pink Drive. And let me tell you, Pink Drive is phenomenal. We do breast examinations and pap smears. Please support us for early detection. Less suffering, less death. Thank you very much. Bye.
And this
Awesome.
is my head nurse over here, Zanile. Say hello to everybody, Zanile. So
Hello, everybody.
we
I'm Nurse Zanele from PinkDrive, the NPO. We specialize with cancer, every kind of cancer. We check up on it. So please support us and come to have some checkups with us. We do all the best.
yeah, and we love Zanile.
Love
We love
PinkDrive.
Zanele, and we want to just show inside the
Oh, okay.
gazebo.
Come have a
So
look.
what we've done is this is what it looks like when you come inside. So we have got stuff that's been sponsored to us from Dischem and stuff along here to do it. We've got a wall in between for privacy so that we can do two people. And it's actually quite nice. If it gets hot, we just open the window. And one more look at my nurse that I love so much. I can't do without her.
PinkDrive too.
Everybody loves Pink Drive. I mean, show me one person that doesn't love Pink Drive.
Wow.
Let me just turn it here to the front camera again. Am I there or have I gone? There.
No, you're back on
Now I'm
again.
back.
Okay.
Yeah.
Okay.
So
Okay.
we encourage people to come here today, okay? It's not for us. It's not going to benefit us. It's going to benefit the public that can get these things all given to them for free. And we were also lucky enough to get Dr. White's sanitary towels and panty liners to hand out to everybody that comes and have a breast examination from Lilette's and Premier. So, I mean, there's nice things to come here. So come down and join us. I'd love to meet you. And when are you
Awesome.
coming to see us? You need to come and see us as well.
Yeah. Yeah, that's true. That's just true. Yeah, I'll definitely make a plan. You just let me know where's the next venue and time. Sorry, and date. Sorry, I'm getting my words all mixed up today.
Yeah. So that Google one that they are doing, I am coming to that one. It's going to be, I don't know how many Googles, but we're going to have fun on that day. It will be very nice to have you with us as well. And we hope that we get a
Okay.
lot of people that watch and can attend.
Okay. I'm just thinking, are you all open to now me asking you the questions, or must I just start with you since I can only see you at the moment? I don't know where Kerusha is
You
and
can
Allison.
ask, who do you want to ask questions to? Karusha
No, no, Allison.
or
I'll start with her
Sister?
since,
Where's Sister
yeah,
Allison? Okay, so let me just turn you.
yeah.
So Sister Allison is busy with someone at the moment.
No, that's
She's going
fine.
to
Then I'll
be
start with
doing.
Kerusha then. That's fine. I'll start with Kerusha then. It's fine. It's not a train
Okay,
smash.
well, let's just show them here because Karishna is just busy with
Okay.
someone. Show them how you do your tests and how you treat your patient when you get here.
Would you like to say something on camera?
Are you happy to be on social media or just your finger?
Just your finger.
Okay, so we won't have her, but we'll have her finger.
Just your finger? Okay, just your finger.
So we're going to show you our diabetic screening tests done by
Okay.
Sister Allison herself.
Something to eat this morning?
Yes, just bring my tea now. Just to I see two bread here, two slices of bread. Thank you.
It's quite easy. I'm sure a lot of people know how these are done. I wish I could show you the breast examinations because it will teach you a lot.
Mm-hmm. Yeah, no problem.
Yes, HIV.
6.9.
Yes,
Perfectly within the range.
So she's fine.
And then they'll show you.
All right. And then when you finish with the patient, Sister Allison, if you can just answer a few questions.
Yes, of course.
Okay. Thank you, dear.
Thank you. Thank you for allowing us. How are you?
I'm fine. Thanks. And yourself? Yeah,
Thank you
Allison,
for having
this
us
wellness.
once again.
Yeah. You're most welcome. I was just gonna say, this wellness day offers services ranging from blood pressure and glucose screening to HIV testing and nurse consultations. Why is it so important to bring these healthcare services directly into communities?
Look, especially with the HIV screening, there's still so much of stigma attached to it. People are afraid to test. They're afraid of the stigma. They're afraid of all the the lack of confidentiality. They're afraid of the test sometimes. And as you've seen, the HIV test is very similar to the blood glucose testing. It's just a simple thing. For me, it's best to know, and then you can protect yourself. HIV treatment now, we've got treatment that is moving up with leaps and bounds. So it's no more a life sentence as it used to be. And, we're trying to destigmatize, bring it down to being as simple as a chronic disease, as simple as blood pressure, as simple as diabetic, those types of tests. So yeah, it's an important test because if you don't know your numbers, you're obviously not going to go back onto treatment. And if
Mhm.
you don't have treatment, that can lead to AIDS. So yeah, it's a very important test.
Okay. What I'm thinking, I'll give you a break for the second question, and then I'll go to Karusha if that's okay.
That's fine. Absolutely. Absolutely.
Yeah. All right. Oh, okay. Oh,
Thank you
oh.
so much for having us. It's really, really nice having this exposure, It's so much needed. Again, with HIV and any of the health screenings, it's sometimes just a lack of education, sometimes a lack of facilities to actually have this test done. So having events like this brings in people that have never tested before. So it's
Of course.
absolutely amazing opportunity to be at outreaches such as this.
Thank you, Sister
Yeah,
Allison.
yeah, yeah. All right.
Okay, I'm going to go
Janice,
to Kerusha.
yeah. Because I'm just thinking of just rotating it. I'm just thinking of just rotating it and then going back to Allison and all that, just to rotate it. Otherwise, I don't want to wear you all down, if that makes sense. Hmm.
That is
Hi,
Kerusha.
Krisha.
Hi, Siddharth.
How are you? All right,
Good.
Krisha. Yeah, I wanted to just ask you, as the mind behind Helpful Scientist, how important is public education in helping people understand the value of preventative health screenings like those being offered at this Wellness Day?
It's absolutely important. In a country like ours, we need to have as much people on the ground helping people to understand their health. We don't want people to just think of healthcare being at the doctor's doorstep or the nurse's doorstep. They have to own their own health. And if we have communities like this, then people will feel that there's a village to help take care of them. And as you know by now, you can see that Janice and Sister Allison's team and our team, we really do care. And so coming out to events like this makes it a bit easier and helps people to prevent illnesses that they could come up with, things like high blood pressure, cancer, issues arising from bad gut health, things like that. So it's a nice platform for people to come, have a relaxed environment, learn a little bit about your health, and there's always something fun happening. Janice always has some fun.
That's beautiful. All right, Krisha, I'll come back to you, but I'll just first start with Janice.
Do you want to speak to me?
Oh, yeah.
Okay. So let me just turn the camera around again.
Yeah, no problem.
There I am.
Awesome. Janice, PinkDrive has become a leading voice in cancer awareness and early detection. What role do events like this Wellness Day play in encouraging people to prioritize their health?
You know, the color pink is amazing and it attracts everybody. So people that haven't heard of Pink Drive, they certainly do by the time we are finished. And we have actually built our name up so that people know that they can rely on us. If we say we're going to be somewhere, they will be there. And so our stand is always for wherever we are. And it is very important for them to come and to have their breasts seen too, because some people, they're scared. They don't want to do it. They'll rather
Mm,
leave it because they don't want to face it. But the thing is, it's not going away. All it's going to do is grow bigger and bigger and bigger. And we try and catch it when it's small, the size of a little pea. Then it's not such a big operation. It's not such a big, like having a mastectomy and stuff. They can basically treat it. But the longer you leave it, the more you're going to end up with maybe a mastectomy where they take the whole boob off, or a lumpectomy where they remove sort of like half off and it looks like a dented can. So it's early detection is one of the most important things that a person can do.
all right.
Really.
I'll come back to Sister Allison now for her second question, if that's fine with you.
Okay, let's just see where she is.
Sure.
Okay, she is talking to someone.
No, it's okay. In that case, I will. In that case, okay. Let me just
Okay,
see.
it's fine. She's talking to Candy. Okay, they are busy doing something else. You'll have to go back to Kerusha. Kerusha, so I'm going to
No,
show Kerusha. Are
sure,
you
no problem.
finished with Kerusha? Look at her nice, healthy sourdough bread, all the seeds and everything that they encourage people to
Uh,
take for your gut health. She's got a very nice stand set up here,
wow.
if you can see. And then this shows you like different skin
Yeah, it's beautiful.
problems. And then she can help you with that. She's very clued up. I'll tell you, she's clever.
Hmm.
So this is quite nice. There's another person going in to have their boobs checked. Oh, they opened the curtain a bit too quickly. And here are some people waiting to
Yeah.
get done. This is our nurse here, Kayla, who actually was very kind enough to drive the team up. So thank you very much for driving the team up.
No, it's a pleasure being here. It's lovely.
Is it?
It's been wonderful.
And are you learning a lot? Because they are trainee nurses. They come with us and we train them. And at the end of the year, I get the honor of capping 10 of them, which is so beautiful.
No, it's really been an honor.
And here's our other one here. And now we just have Sister Allison that's just finished. Sorry, wants to ask you one more question. You can
Hello
Yeah.
again.
Hi. I'm just thinking, I'll make it easy. I'll just ask you your second and third question straight away, as if I don't end up interrupting you unintentionally. So it's fine. All right. Let me just get back to the top here quickly. All right. Mediskills Academy is partnering with organizations such as PinkDrive and Hillcrest AIDS Centre Trust for this event. How do these collaborations help create a more comprehensive healthcare experience for attendees?
Look, for me, it's everybody bringing in their expertise, taking it out to the community. You can't be a one-man band and trying to lead this big community organization. So you need collaborations. Mediskills, helpful scientists, and then we have the Hillcrest AIDS Trust Center. It's an amazing collaboration today, simply because there's all health services. And again, like I mentioned earlier, it's an important collaboration. HIV/AIDS, there's still stigma. There's 8 million cases, the last stats. I could be right. There's only 5 million on treatment. So there's this huge gap between the ones that are positive and then the ones that are on treatment.
Battling to stay on treatment as well.
Yes,
Adherence, even if they started. Yeah,
absolutely. It's the compliance. So we need events like this to showcase the importance of number one being tested, number two compliance with the medication, and protecting each other, protecting themselves, protecting our communities. That's a big thing. It's very, very important. Everybody should be tested. They should be protecting themselves and also being some sort of
Hmm.
protection wise to others. It's an important thing. Anything, Candace?
Yeah.
If it takes a community to raise a child, it takes a community to promote
Absolutely.
health and screening, education, awareness. The better we can collaborate and do that collectively to say we own our own health, we own our family's health, our personal health, and our community's health, and make those services available.
Absolutely. Absolutely. Are we
Alison,
good?
lastly, I know, Alison, lastly, for someone who may be nervous about attending a health screening for the first time, what message would you like to share with them?
Sorry, can you just repeat that?
Sure. I was asking for someone who may be nervous about attending a health screening for the first time, what message would you like to share with them?
I'd like to say to them that
Mhm.
I have to say this. Testing, especially for HIV, for your diabetic screening, it's just one single tiny finger prick in comparison to not knowing about your health.
I just did
Mhm.
mine.
Yes, there we go.
Yeah, she just did
I
it.
just did mine.
Was it?
No, A-okay. And it's better to know.
Absolutely.
Yeah.
Again, it's just that one finger prick. And there could be a difference
Mm.
between knowing and not knowing. Knowledge is always power.
Absolutely.
Knowledge is
Well,
always power.
And these ladies are warm and friendly and welcoming.
Thank you.
Oh, thank you. We take our bubbly joy and that with us wherever we go.
Yes. Thank you, Candace. Are we good?
yeah, we're all good. Okay, I'll get to Kerusha now, if that's okay with you, Janice.
Okay, just hold on. She is with someone.
Okay, Janice, if you want, I could just attend to you then for the last two
Yeah,
questions on your side.
yeah, okay.
Okay. Breast examinations and education are key services being offered. What are some warning signs and preventative measures that every woman should know about?
What is what?
Oh, sorry. I was asking, what are some warning signs and preventative measures that every woman should know
Oh,
about?
okay.
Hmm.
So everybody's boobs are different, okay, and everybody knows their boobs, but one boob is normally bigger than the other. If you notice that the one boob is even more bigger than the other, because you know what it looks like. That's a cause of concern, okay? If you've got any discharge coming from your nipples, if your breast has got that, oh gosh, can you see me? If your breast has
Yeah,
got that like orange peel look with like little dots and that in it, or if it's indented, or if there's a big lump sticking out, or if it's sore. Those are the type of things that you need to look out for. And when you do your self breast examination, you need to check it properly. And don't, if you find a lump, say, oh, I've got cancer, because it could be a cyst. But those are any abnormality that is in your breast that was not there before. You need to go and have it checked. That's my advice to everybody. Yeah.
all right. My last question for you, again, Janice, is Pink Drive is known for taking healthcare directly to communities. What impact have you seen when healthcare becomes more accessible to people who might otherwise not get screened?
Well, they love it when they hear that we are coming, because people can't get to the
Mhm.
local clinics. They can't get to hospitals because they stay in rural areas. They're miles away from a taxi or a bus or something, and they have to walk absolute miles. And here we come and we pull in right there by them. And we do whatever. And they line up, let me tell you, patiently waiting their turn to get all these medical services that we give them. So, yeah, I get very emotional when I talk about Pink Drive. I absolutely love it with
Of
all
course.
my heart. It's not just a job, it's my whole
Mm,
life. But they are the most real, caring company, that not only cares about the people out there, but they care just as much about their staff. Their staff, we are not just a number. We
mm.
are a team, and we take care of each other. Pink Drive.
Ah, that's beautiful. Is Kerusha free now?
Hold on.
Sure.
Kerusha, can she just finish her last one and come back to you?
Yeah,
Oh, she's
sure.
back.
Oh, sorry. Yeah, sorry, Kerusha. All right, I'll just ask you two questions quickly. It's many people delay health checks because of fear or misinformation. What are some of the biggest myths you encounter, and how can science help address them?
There's so many myths, but we'll start with the simple, easy one of everyone thinking they're fine, or they tell themselves they're fine because they have to get on with their life. But there are simple checks we can do to see if we're okay. So by the time people have strokes and heart attacks, a few months, maybe a few years ago, there would have been some signal, some sort of high blood pressure that we could have monitored, and we could have given them high blood pressure tablets, and that would have prevented the stroke. Or if we had found a small lump that is in stage one cancer stage, we could have helped the person before it got to stage three, and then we're giving them heavy chemotherapy drugs, and the person's quality of life is so depleted. So things like these events, it helps people to make sure that they can take control of their health. And it's absolutely important to know the basic levels. And you don't have to think you're sick. Just do it as a checkup, a once in a while checkup. It doesn't have to be every 10 years or 5 years like what most people are doing. When they're very sick, then they go and find out what are the basic levels. Screenings like this will help you prevent major illnesses, and your quality of life, the quality of life of the family is going to be so much better if you can help yourself well before there's major illnesses that now requires hospitalization, lots of bills people can't afford to pay, don't have caregivers, things like that. So rather stay as healthy and strong as possible. And these events are definitely the ways we can get communities out and to think about their health and empower them to take control of their own lives.
How can science, communication, and community outreach work together to empower people to take greater control of their health and well-being?
Right. So for me in South Africa, you have to understand we have 11 official languages for a reason. We all don't speak the same language.
Of course.
We need to be able to have everybody understand what we're saying. Just because we are saying it in English and we're saying it with the terms doesn't mean the person understood it. So we need to communicate in a way that the person can understand what their body is doing and what the solutions are so they can make informed choices. So the communication of the science and the health, it's so important. And I encourage any organization that wants to do things like this because it makes such a big impact. PinkDrive has been doing this for years. Mediskills have been doing this for years. And everywhere you go, people will remember things that Janice has done and shown up because we need people to communicate and explain how they can help themselves, how they can empower themselves. So yeah, it's absolutely important, and I'm really, really proud that we get to do all of this work. And thank you, PinkDrive, and thank you, Mediskills, for coming out as well and doing this.
Yeah, sorry,
Excellent.
I just got a comment. Yeah, sorry, actually, they have a comment question for all of you all. So this is from
Yeah.
Yudhishthit and hi, Allison and Kerusha, as well as Janice. Thank you for giving back to the community. Have you experienced where an ailing elderly is abused and left alone to fend for themselves and need urgent medical attention?
So we don't, no, no, we haven't come with that.
Okay,
Yeah, we are
oh,
more in the cancer field, and
okay.
we do deal with the elderly. Look, if we
Mhm.
find someone that needs help, we will make sure that they
Mm.
get help. We won't just leave them. But it's not
Of course, of course.
a common thing, yeah.
Yeah, I
Okay.
mean, look, it is Elder Abuse Month, and it is an important topic. And yeah, if we need to, if we ever come across a case, we will of course help. But it is an important topic, so thank you whoever posted that. We do have to consider that elder abuse is a major problem in our country, and people do need to be aware of it and try to help the elderly age as gracefully as possible.
Thanks so much for your time, Karusha.
Thank you, Karusha.
Thank you. Bye.
Oh, Janice, does Alison have the same thoughts as well?
Does Sister Allison have?
Have the same thoughts as well regarding to that comment question?
Sister Allison, have you come across any ailing people that have been abused and need help and stuff like that?
Not today, but the day is still very certainly not.
In general.
Yes, yes, absolutely, absolutely. At our outreaches, one of the big things is they come to us actually because of anonymity, should I say. Most of these outreaches, we see them and they don't know us and we don't know them. So they very assured of confidentiality. So more often than not, when they do come to us, and if they have any issues, we have little tables we counsel them, and they are always referred either to a social worker or somebody within their family, and there's always follow-ups done. So these outreaches are such an amazing way to reach so many people and so many different segments, not just their health. Mental health, like I always say, is very important as well. So it's just all part of our outreach program. Yeah.
Thanks so much for your time.
Pleasure, absolute pleasure.
Anything else you'd like to know?
No, Janice, thanks so much for your time and also thanks for showing me around. It really was wonderful.
Yeah, I think it's very nice for people to see what we do.
Yeah, as usual, it's always a pleasure to have you all, and I will send you a copy of this.
Yeah, thank you very much. Thank you for putting this on your show. We are very grateful. We're also thankful to the Singh Foundation for sponsoring us to come here today. And I'm glad that you've seen what we do firsthand.
Yeah, yeah, we'll keep in touch. Take care and God bless.
Okay. All right. Thank you. Bye bye, everyone.
All right, you're just gonna go to one of the ladies.